Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will cover other important topics of evolution and management, including consultation and preventive medicine services, along with the guidelines and practice questions to help you to easily grasp the concept. So, without further delay, let's get started. A consultation is a type of evolution and management service provided at the request of another physician, other qualified healthcare professional, or appropriate source to recommend care for a specific condition or problem. A physician or the qualified healthcare professional consultant may initiate diagnostic and or therapeutic services at the same or subsequent visit. A consultation initiated by the patient and our family and is not requested by a physician or the qualified healthcare professional or other appropriate source is not reported using the consultation codes. The consultant opinions and any services that were ordered or performed must be communicated by written report to the requesting physician or other qualified healthcare professional or other appropriate source. If a consultation is mandated, like by the third party pair, modified 32 should be reported. To report services when a patient is admitted to the hospital inpatient or observation status or to a nursing facility in the course of an encounter in another setting, use initial hospital inpatient or observation care or initial nursing facility cares code. The code range 99,242 to 99,245 is used to report office or other outpatient consultation. Code selection is based on either MDM or time. Code 99,242 is for office or other outpatient consultation for a new or established patient, which requires a medically appropriate history and or examination and straightforward medical decision making. Code 99,243 is for the moderate level of medical decision making. Code 99,244 is for moderate level of medical decision making. And Code 99,245 requires a medically appropriate history and an examination and high level of medical decision making. When using total time on the date of encounter for code selection, code 99,242 requires a minimum of 20 minutes. The time range applicable to 99,242 is 20 to 29 minutes. Code 99,243, the time range is 30 to 39. For code 99,244, the time range is 40 to 54 minutes. And for code 99,245, it is from 55 to 69 minutes. For services of 70 minutes or longer, use prolonged service code 99,417. Office or other outpatient consultation codes may be used to report consultation data provided in the office or other outpatient sites, including the home or residence or emergency department. Follow-up visit in the consultation office or other outpatient facility that are initiated by the consultant or patient are reported using the appropriate code for established patient in the office or home or residence. Services that constitute transfer of care are reported with the appropriate new or established patient code for office or other outpatient visits or home or residence services. For an outpatient consultation requiring prolonged services, use code 99,417. The code range 99,252 to 99,255 is used to report inpatient or observation consultation. Code selection is based on either MDM or time. Code 99,252 is used for inpatient or observation consultation for a new or established patient, which require a medically appropriate history and or examination and straightforward medical decision making. Code 99,253 is for moderate level of medical decision making. Code 99,254 is for moderate level of medical decision making. And Code 99,255 requires a medically appropriate history and or examination and high level of medical decision making. When using total time on the date of encounter for a code selection, code 99252 requires a minimum of 35 minutes. The time range applicable to code 99252 is 35 to 44 minutes. For code 99253, the time range is 45 to 59 minutes. For code 99254, the time range is 60 to 79 minutes. And for code 99255 is for 80 to 94 minutes. For services of 95 minutes or longer, use prolonged service code 99480. Inpatient or observation consultation codes are used to report physician or the qualified healthcare professional consultation provided to hospital inpatient, observation level patient, resident of nursing facility, or patients in the partial hospital setting. These codes are used when the patient has not received any face to face professional services from the physician or other qualified healthcare professional or another physician or other qualified healthcare professional of the exact same specialty and subspecialty who belongs to the same group practice during the stay. Only one consultation may be reported by the consultant per admission. Subsequent consultation services during the same admission are reported using subsequent inpatient or observation hospital care codes or subsequent nursing facility care codes. For inpatient observation or consultation requiring prolonged services, use code 99418. A 63-year-old man wants a second opinion for his sleep apnea. He decides to go Dr. X, who his neighbor referred him to see if Dr. X can provide another type of treatment. Dr. X documents a detailed history. He has it for the past 5 months. Sleep is disrupted by the frequent awakening and getting worse due to anxiety and snoring. Current medication that he is on is not helping him. Physician also performs a comprehensive exam and moderate MDM, which evolution and management category is reported for this encounter. Option A, new patient office visit. Option B, established patient office visit. Option C, office consultation. Option D, observation care. The patient was not referred by another physician for the second opinion for his sleep apnea, so this is not a consultation visit. The patient decides to go on his own to get the opinion from another doctor. According to CPT guideline, a consultation initiated by the patient and our family and not requested by a physician or other qualified healthcare professional or other appropriate source is not reported using the consultation code. The doctor is seeing the patient at his office for the first time. The evolution and management category to report an evolution and management code from this is the new patient office visit from the code train 99202 to 99205. Dr. Smith, a urologist, seized a 55-year-old patient for an office consultation at the request of his primary care physician. The patient has had bright red blood in his urine sporadically for the past 2 weeks. The urologist obtains a detailed history from the patient and continues with the detailed physical examination. The urologist recommends a cystoscopy to be scheduled for the following week and discusses the procedure and risks with the patient. The medical decision making is of moderate complexity. Report only the office service. Option A with the code 99253, option B with the code 99244 along with modifier 57 and 52000. Option C with the code 99244 along with modifier 57. Option D with the code 99221. In the given scenario, it is an office consultation which is done at the request of primary care physician. Office consultation means it is an outpatient service. On the basis of outpatient service, we first element option A with the code 99253 used for inpatient consultation and option D with code 99221 used for initial hospital inpatient or observation care. Both option B and C with code 99,244 are used for office or other outpatient consultation, which requires a medically appropriate history and or examination and moderate level of medical decision making. In the option B, code 52,000 is for cystourethropy, which is a separate procedure. In the given scenario, no procedure is done. The urologist just recommends scheduling of cystoscopy for the following week and discusses the procedure. This is indicated by the Modify 57, which is used for the evolution and management service that result in the initial decision to perform the surgery. So, a correct option is option C with the code 99,244 along with modifier 57. The code range 99,381 to 99,387 is used to report initial comprehensive preventive medicine services for a new patient. Code selection is based on age from early childhood to age 65 and older. The code range 99,391 to 99,397 is used to report periodic comprehensive preventive medicine services for an established patient. Code selection is based on age from early childhood to age 65 years and older. Preventive medicine services codes are used to report preventive medicine's evolution and management of infant, children, adolescents, and adults. The extent and the focus of the service will largely depend on the age of the patient. If an abnormality is encountered or pre-existing problem is addressed in the process of performing this preventive medicine evolution and management service, and if the problem or abnormality is significant enough to require additional work to perform the key component of the problem oriented evolution and management service, then the appropriate office or outpatient code should be reported. Modify 25 should be added to the office or outpatient code to indicate a significant separately identifiable evolution and management service was performed on the same day as the preventive medicine service. An insignificant or trivial problem or abnormality that is encountered in the process of the preventive medicines evolution and management service and which does not require additional work and the performance of the key component of the problem oriented evolution and management service should not be reported. Code 99,381 to 99,397 include counseling, anticipatory guidance, risk factor reduction, intervention, which are provided at the time of initial or periodic comprehensive preventive medicine examination. The code range 99,401 to 99,404 is used for preventive medicine counseling and a risk factor reduction intervention provided to an individual. Code selection is based on time. The code 99,406 and 99,407 is used when the provider counsels the patient on how to stop tobacco use. For code 99,406, the counseling is intermediate, lasting more than 3 minutes up to 10 minutes. For code 99,407, the counseling is intensive, lasting greater than 10 minutes. Code 99,408 is used for screening a patient for alcohol or other non tobacco substance abuse, with the screening lasting 15 to 30 minutes, followed by a brief intervention in the same session. For code 99,409, the counseling lasts more than 30 minutes. The codes 99,411 and 99,412 are used for the preventive medicine group counseling. Code 99,411 is for approximately 30 minutes and code 99,412 is for approximately 60 minutes. Counseling risk factor reduction and behavior change intervention codes are used to report services provided face to face by physician or the qualified healthcare professional for the purpose of promoting health and preventing illness or injury. Any evolution and management service reported on the same day must be distinct and reported with modifier 25, and the time spent providing these services may not be used as a basis for the evolution and management code selection. Risk factor reduction services are for the individual without a specific illness, where counseling might be a part of treatment issues such as family problems, diet and exercise, substance use, sexual practices, injury prevention, dental health, and diagnostic and laboratory test result available at the time of the encounter. Behavior change interventions are for persons who have a behavior that is often considered an illness itself, such as tobacco use and addiction, substance abuse, misuse, or obesity. Behavior change services may be reported when performed as a part of the treatment of conditions related to or potentially exacerbated by the behavior or when performed to change the harmful behavior that has not yet resulted in the illness. A mother brings her 3-year-old child back to Dr. Stephen for an annual well child exam. The patient receives a comprehensive checkup and vaccinations are brought up to date. Which category or subcategory of evolution and management code should be selected for the well child exam? Option A for office visit of an established patient. Option B for preventive medicine services of an established patient. Option C for subsequent hospital inpatient or observation care. Option D for the preventive medicine individual counseling. The mother takes her 3-year-old child back to the Dr. Stephen, indicating that this is an established patient. Since this is a well child exam with no complaints, preventive medicine service category codes are used. Option D for the preventive medicine and individual counseling codes are utilized for the risk reduction, such as diet, exercise, substance abuse, or family problems. For the well child exam of an established patient with no complaints, the correct option is option B, which corresponds to the preventive medicine service category for an established patient from range 99,391 to 99,397. A 32-year-old female new patient comes in for a preventive medicine visit required by her employer. The physician completes all requirements for the preventive visit. During the history portion, the patient tells the physician that she has been receiving some knee pain exacerbated by running. The physician obtains additional history about the pain, examines her knee, tells her to reduce her running until the pain subsides, and gives her a handout on knee exercises. He also recommends she try a knee brace and follow up if the pain does not lessen with rest. The physician documents the extra work done to address the knee issue. What CPT codes are reported for this visit? Option A with the code 99,385, option B with the code 99,395 and 99,203 along with modifier 25. Option C with the code 99,395, option D with the code 99,385 and 99,203 along with modifier 25. As we know, this patient is a new patient coming in for the preventive medicine visit. For new patient preventive medicine service, we use the code range 99,381 to 99,387. We will first element option B and C as code 99,395 is used for established patients. In the given scenario, after completing all requirements for the preventive visit, the physician documents the extra work done to address the knee issue. According to CPT guideline, if the abnormality is encountered, a pre-existing problem is addressed during the preventive medicine evolution and management service, and if the problem or abnormality is significant enough to require additional work to perform the key components of the problem-oriented evolution and management service, then the appropriate office or outpatient code should be reported. Modify 25 should be added to the office or outpatient code to indicate that a significant separately identifiable evaluation and management service was performed on the same day as the preventive medicine service. The appropriate preventive medicine service should be reported. Based on this guideline, we will eliminate option A with the code 99,385. Therefore, the correct option is option D with the code 99,385 and 99,203 along with modifier 25. Thank you for watching. If you have any question or need further clarification, please feel free to write in the comment section. For more detailed guidelines, CPC mock exam related questions and notes, email me at the giving email ID.